Downtown Brooklyn is home to a large community of Africans who have limited access to public health care. But recently, a group banded together to help those who need medical attention but who don't have health insurance. Our correspondent Mimi Chiaman has the story.
A neighborhood mainstay, Nelson's Barbershop has been on this block for 25 years. And 15 years ago, despite being in the business of haircuts, owner Nelson Uraka started talking to his customers about their health. He works with the Arthur Ashe Institute, an organization committed to helping immigrants and low-income families. By asking questions of his customers, Nelson hopes to highlight the health issues that disproportionately affect black men.
There are issues that we have in this neighborhood, and because of lack of health care, we don't go and seek it.
He's talking specifically about prostate cancer and HIV, both sensitive issues, but the safe space allows for open conversation.
It is intimate. You came here for a specific reason, so you're not nervous, you're not, you know what I mean? It can lead to something way bigger than what you came for. So I do know that the space is intimate. I know that the space is relaxed, and you know, I can guide you to your next step just by being here.
Socioeconomic disadvantages make access to healthcare a challenge in this community. The disparity is glaring, and some say policy and clinical trials leave much to be desired. Where they fall short, grassroots initiatives have stepped in to bridge the gap.
We wanted to make sure that we can improve access to health in addressing some of those social determinants of health and making sure that people receive better health care so that health outcomes could be improved.
According to the Center for Disease Control, residents in central Brooklyn have some of the highest mortality rates compared to other residents in New York City. But for many, visits to the barber are more regular than visits to the doctor.
The truth is, if you're going to have programs that are hospital-based or clinic-based, you're going to miss out on a big part of this population because a lot of the folks don't have health insurance, so a lot of them will not be at the hospitals or the clinics. One of Arthur's famous quotes is, "Start where you are, use what you have to do what you can." So we go where they are to be able to use what we have in the community and to be able to bring change.
But there's only so much the Institute can do on its own. Instrumental changes need to come from above.
Starting with your local legislators, the state level, and even nationally, that we can inform. If we can inform policy and can subsequently help to change policies to improve health outcomes, I think that will be effective.
More jobs will mean you have options to eat better food. You know, more jobs will mean you may have more time to exercise. So I think economics is a big part of something that will bring change.
It could be some time before Central Brooklyn sees such changes, but in the meanwhile, over 300 local businesses and organizations are doing their part to advocate for better health. Mimi Chiaman for Telesur, New York.